MHSRB ఎగ్జామ్ కౌంట్ డౌన్ 8 ఇంకా చాలా రోజు నియర్ వచ్చేస్తుందండి. కొన్ని క్వశ్చన్స్ రాంగ్ అని టెక్స్ట్ బుక్లో అని అట్లా చెప్తున్నారండి. లేదు, నేను చాలా వెరిఫై చేసి అదర్ టెక్స్ట్ బుక్స్లో అండ్ గూగుల్లో కూడా చూసి వెరిఫై చేసి నేను ఆప్షన్స్ పెడుతున్నానండి. సో ఇది ఓన్గా పెట్టింది కాదు. సో వెరిఫైడ్ ఆన్సర్స్ సాల్వ్డ్ ప్రాబ్లమ్స్. వెల్కమ్ టు మై ఛానల్. స్టే సేఫ్, స్టే హెల్దీ. క్వశ్చన్స్ నేను చదువుతానండి, ఆన్సర్స్ మీరు పెట్టండి. కమెంట్ బాక్స్లో కమెంట్ చేయండి. ఏ క్వశ్చన్ కరెక్ట్గా రాశారు, ఏ క్వశ్చన్ రాంగ్ అయిందో టోటల్ కూడా మీరు పెట్టండి. అలా పెట్టడం వల్ల మీ కాన్ఫిడెన్స్ లెవెల్స్ పెరుగుతాయండి. ఎందుకంటే కేవలం ఇలా చూసి చదవడం వల్ల మనకేమీ రాదు. ప్రాక్టీస్లో కనుక మనం పెడితే లాస్ట్ మనం ఎంతవరకు జెన్యూన్గా ఆన్సర్స్ కరెక్ట్గా రాస్తున్నామో, ఇంకా ఎంత ఇంప్రూవ్ అవ్వాలనేది మనకు తెలుస్తుంది. హార్డ్ వర్క్ విల్ పే ఆఫ్. ఖచ్చితంగా ఈసారి మీరే జాబ్ కొట్టాలి. సో అన్ని క్వశ్చన్ పేపర్స్ని మీరు రివైజ్ చేసుకోండి. మిగతా సబ్జెక్ట్స్ తెలుసుకోవాలంటే వేరే పార్ట్స్లో నేను చెప్పానండి, ప్రతి పార్ట్ మీరు చూడండి. సో లెట్ us start the questions. Physician wants central venous catheterization. Nurse has to know which vein he should make use of. A. Radial vein, B. Femoral vein, C. Basilic vein, D. Cephalic vein. Did you guess the answer? It is B. Femoral vein. ఇక్కడ నేను ఆన్సర్కి ఎక్స్ప్లెనేషన్ పెడుతున్నానండి, చదవండి. 25-year-old lactating women presented with fever, acute breast pain and swelling. Which one of the following organisms cause this acute breast problem? A. Streptococcus, B. Staphylococcus, C. Enterococcus, D. Pneumococcus. ఆన్సర్ కమెంట్ బాక్స్లో రాసేసారా? ఇట్ ఈస్ ఆప్షన్ బి, స్టెఫైలోకోకస్. ఇక్కడ కొన్ని కీ పాయింట్స్ పెట్టానండి, చదవండి. Nurse caring for a patient with breast mass may have to know that all the following facts are true regarding fibroadenoma of breast, except A. Rubbery, non-tender mass. B. Moves freely inside breast. C. Occurs in postmenopausal women. D. No treatment or excision biopsy is usually done. Did you write the answer? It is option C. Occurs in postmenopausal women. Please read above concept. Nurse has to counsel a pregnant lady regarding puerperium. She has to suggest the patient the normal duration of puerperium. Which one of the following is normal duration of puerperium? Did you guess the answer? It is option C, 6 weeks. Please read the explanation given here. All the following are complications of twin pregnancy except A. Abortion, B. Post-maturity, C. Low birth weight, D. Congenital malformations. Did you write the answer? Twin pregnancy complications except it is option B, post-maturity. Please read the given explanation here. Pre-renal failure occurs in A. Heart failure, B. Nephrolithiasis, C. Toxic nephropathy, D. Glomerulonephritis. Did you guess the answer? It is option A, heart failure. Please read the above explanation. Islets of Langerhans are concentrated in which portion of pancreas? A. Head, B. Body, C. Tail, D. Uncinate process. Islets of Langerhans ఎక్కడుంటాయి? రాసారా? It is option C. Tail. Please read the above explanation. Hyperfunctioning of anterior pituitary in prepubertal children causes A. Gigantism, B. Acromegaly, C. Addison's disease, D. Cushing's disease. It is option A. Gigantism. All the following are associated with increased chance of acquiring HIV infection in women except A. Chlamydia infection, B. Bacterial vaginosis, C. Herpes simplex infection, D. Trichomonas vaginalis infection. It is option B. Bacterial vaginosis. Please read this explanation. Nurse carrying a high-risk pregnant lady with heart disease must know which one of the following valvular lesions cause death during labor. A. Aortic stenosis, B. Aortic regurgitation, C. Mitral valve stenosis, D. Mitral valve regurgitation. Did you wrote the answer? It is option C. Mitral valve stenosis. Please read this explanation. Which one of the following cancer that does not metastasize commonly to liver? A. Breast, B. Lung, C. Colon, D. Prostate. Did you got the answer? It is option D. Prostate. Please read the above explanation. Direct action of parathyroid hormone include everything except A. Increased resorption of calcium from bone, B. Increased absorption of calcium from intestine, C. Increased absorption of calcium from kidney, D. Increased production of 1 to 25 dihydroxy vitamin D. Did you wrote the answer? It is option B. Increased absorption of calcium from intestine. Please read above explanation. All the following cancers have infective etiology except A. Squamous carcinoma of penis, B. Squamous carcinoma of lung, C. Burkitt's lymphoma, D. Kaposi sarcoma. Did you wrote the answer? It is option B. Squamous carcinoma of lung. Please read this explanation. All are true regarding vitamin A except A. It is found in green leafy vegetables, B. High dose of pregnancy in teratogenic, C. Supplementation reduce mortality in measles, D. Supplementation reduce morbidity in diarrhea. Did you get the answer? Is option C, supplementation reduce mortality in measles. Please read this explanation. What is the best way to be adopted by a nurse to avoid hematoma formation when undertaking venipuncture? Choose a vein that is soft and refills fast. B. Tap the vein hard before venipuncture. C. Apply I firm U pressure for 1 minute after procedure. D. Apply heparin U containing ointment after procedure. Did you get the answer? It is option A. Choose a vein that is soft and refills fast. Check this explanation. Nurse giving oxygen therapy should know that it has to be humidified because A. Oxygen is a hot air and it may burn trachea. B. Oxygen is a dry gas and thickness the mucus. C. Oxygen gets cleaned off pathogens by humidification. D. Oxygen is easily absorbed because humidification and H. Iron to it. Did you wrote in comment box? It is option B. Oxygen is a dry gas and thickens the mucus. Nurse engaged in suction process of tracheostomy in situ patient who requires frequent suctioning. How long she should do suctioning every time? A. 15 seconds, B. 30 seconds, C. 45 seconds, D. 60 seconds. Did you guess the answer? It is option A. 15 seconds. Please read above explanation. Nurse taking care of a pregnant lady is being asked about when to start breastfeeding. What should be her appropriate reply? A. 2 hours after delivery, B. 4 hours after delivery, C. 6 hours after delivery, D. 8 hours after delivery. Easy question. Yes, it is option A. 2 hours after delivery. Please read explanation. A nurse must be aware that eating maize alone may lead into A. beriberi, B. pellagra, C. scurvy, D. phrenoderma. Did you guess the answer? It is option B. pellagra. Please read the explanation. A nurse observes palmar erythema and she understands that it is met within A. cardiac failure, B. renal failure, C. hepatic failure, D. adrenal failure. Did you guess the answer? It is option C. hepatic failure. Please read the above explanation. సారీ అండి, ఇక్కడ ఒక ప్రింటింగ్ మిస్టేక్ ఒకటి తప్పైంది. సో ఐఎమ్ రీడింగ్ ఇట్ రైట్. వన్ హెల్పింగ్ ఏ స్ట్రోక్ నర్స్ షుడ్ అసిస్ట్ ఆన్ వీక్ సైడ్, బి ఆన్ స్ట్రాంగ్ సైడ్, సి ఫ్రమ్ బిహైండ్, డి ఫ్రమ్ బ్యాక్. Did you guess the answer? It is option A on weak side. Please read the explanation. To avoid pulling the urinary catheter, Nurse should tape the catheter on patient's A. upper thigh, B. lower thigh, C. hind leg, D. foot. It is option A. upper thigh. Read the explanation given above. 16-year-old primary gravid patient admitted with severe pregnancy induced hypertension is given intravenous magnesium sulfate. The nurse should obtain which of the following information? A. Urinary output every 8 hours. B. Deep tendon reflexes every 4 hours. C. Respiratory rate every hour. D. Blood pressure every 6 hours. It is option C. Respiratory rate every hour. Please read above explanation. Which one of the following nursing measures would be most appropriate in the care of patient who has acute epistaxis? A. Tilt the patient's head back. B. Place the patient's head between his legs. C. Pinch the nose and have the patient lean forward. D. Place warm compresses on the patient's nasal bridge. Did you got the answer? It is option C. Pinch the nose and have the patient lean forward. Please read given explanation. Which of the following actions would a nurse take first when caring for a patient experiencing a cardiac arrest? A. Initiate cardiac monitoring. B. Provide intravenous access. C. Establish an open airway. D. Obtain a pulse oximetry reading. Easy one. It is option C. Establish an open airway. Please read the given explanation. When caring for a patient who has intermittent claudation, nurse advises the patient to apply graduated compression stockings, B. Elevate the legs when sitting, C. Refrain from vigorous exercise, D. Walk as much as tolerated. It is option D. Walk as much as tolerated. Please check the explanation here. A lethargic patient have fever, vomiting, headache, and the nurse has to prepare him for which one of the following procedure? A. Blood culture. B. Lumbar puncture. C. CAT scan. D. Ultrasound exam. Did you got the answer? Yes? It is option B. Lumbar puncture. Please read the explanation. An active male patient who weighs 180 lb 81.65 kg has undergone dietary instruction. The patient reports that his current diet consists of 60 grams of fat, 200 mg of cholesterol, and 5 grams of sodium per day. What a nurse advises the patient to do? A. Increase his cholesterol. B. Increase his sodium. C. Decrease his cholesterol. D. Decrease his sodium. Sorry అండి, D బదులు B పడింది లాస్ట్ వన్. Yes, it is option D. Decreases his sodium. Check this explanation. A 55-year-old male patient who is diagnosed with an evolving myocardial infarction insists on going home. The nurse encourages the patient to be admitted because the greatest risk within the first 24 hours of sustaining an MI is A. Heart failure, B. Sudden death, C. Pulmonary embolism, D. Ventricular aneurysm. Did you got the answer? It is option B, sudden death. Please check the given explanation. Nurse is about to catheterize bladder of a pregnant lady. She should be aware that all the following facts about female urethra are true except A. It is about 1.5 inches in length. B. It's posterior to vaginal orifice. C. It pierces through urogenital diaphragm. D. It is straight and offers minor resistance for catheterization. It is option B. It's posterior to vaginal orifice. Please read the given explanation. క్వశ్చన్స్ అన్నీ చదివారు కదండి. పెట్టిన ఎక్స్ప్లెనేషన్ని జాగ్రత్తగా చదవండి సో దట్ మీ డౌట్స్ అన్నీ క్లియర్ అవుతాయి. చాలా వెరిఫైడ్ ఆన్సర్స్ నేను పెట్టాను. స్టే సేఫ్, స్టే హెల్తీ. డోంట్ ఫర్గెట్ టు సబ్స్క్రైబ్, షేర్ చేయండి. థ్యాంక్ యూ.